In this video, we'll go through what a caesarean section or C-section is, the different types of C-sections, how a C-section is performed, and why you might end up having a C-section. A caesarean section or C-section is a surgical procedure used to deliver your baby through an incision made in your abdomen and uterus. It is performed when a vaginal delivery is not considered safe or possible, either due to medical reasons or complications during your pregnancy or labour. So why might you need a C-section? The first is because of fetal distress. So a C-section may be performed when there are signs of fetal distress, such as abnormal fetal heart rate patterns, indicating that your baby is not tolerating labour well and an expedited delivery is needed to prevent complications. The next is labour dystocia. So a C-section may be needed when your labour is not progressing adequately, despite efforts to speed up or facilitate a vaginal delivery, leading to a prolonged or arrested labour, which occurs when your labour stalls and your cervix stops dilating for an extended period, or your baby stops descending through your birth canal despite strong contractions. Another reason is malpresentation. A C-section may be recommended if your baby is in a breech, transverse or other abnormal presentation that would make vaginal deliveries unsafe or impractical. A C-section may also be necessary if your placenta is covering or near your cervical opening, called placenta previa. This increases the risk of bleeding during vaginal delivery. If you've had a previous C-section, another C-section may be planned for you to reduce the risk of complications associated with a vaginal birth after caesarean or a VBAC. And finally, a C-section may be recommended if you have certain medical conditions, such as heart disease, an active genital herpes infection, or other conditions that increase the risk of complications during vaginal delivery. There are different types of C-sections. The first type is an elective C-section or planned C-section, which is scheduled before your labour begins, usually for medical or obstetric reasons, or at your request for personal or non-medical reasons. The next type is an emergency C-section or an unplanned C-section, which is performed during labour or after labour because of urgent medical indications or complications requiring a faster delivery. Finally, there is a scheduled repeat C-section, which is a planned C-section scheduled if you have a history of previous C-section deliveries and is usually performed before your labour begins to reduce the risk of complications associated with VBAC or a vaginal birth after a C-section. So let's go through how a C-section is done. Before the surgery begins, anaesthesia is given to you to ensure you are comfortable and pain-free during the procedure. This may include epidural or spinal anaesthesia for regional anaesthesia. Regional anaesthesia is a type of pain relief that numbs the lower part of your body, including your abdomen, pelvis and legs, by blocking sensation in that region, but allowing you to stay awake. However, in certain emergency situations, general anaesthesia may be used. Now, general anaesthesia is used during labour to put you into a temporary, controlled, unconscious state where you are completely unaware of the birth process. It is typically used in an emergency situation, such as during an urgent caesarean section, when other forms of anaesthesia are not safe or effective. Next, a surgical incision is made in your abdomen and uterus, usually in a horizontal or transverse or along your bikini line fashion, below your navel, called a low transverse incision, or vertically from your navel to the pubic bone, called a classical incision. Your baby is carefully delivered through the incision, guided by your healthcare provider's hands or with the assistance of forceps or vacuum extraction if needed. After your baby is delivered, your placenta is removed from your uterus and the uterine incision is closed with sutures or staples to prevent bleeding. Let's go through the risks and complications of a C-section. So the first is infection. A C-section carries a risk of surgical site infection, uterine infection or wound complications, particularly if proper sterile techniques are not followed. Then there can be a risk of excessive bleeding during or after C-section, requiring transfusion or additional surgical interventions to control the bleeding. There can also be anesthesia-related complications such as allergic reactions, respiratory depression, or nerve injury, which may occur during or after C-section. A C-section may be associated with surgical complications such as injury to nearby organs, bladder, bowel, blood vessel injury, or adhesion formation. And there can be long-term effects on your health, such as increased risk of uterine rupture, placenta accreta, or pelvic floor dysfunction in future pregnancies. Placenta accreta is a serious pregnancy condition where your placenta grows too deeply into the wall of the uterus and fails to detach properly after childbirth. This can lead to severe bleeding and other complications during delivery. And this often requires a caesarean section and in some cases a hysterectomy to control the bleeding. So to summarise, a C-section is a surgical procedure used to deliver your baby through an incision in your abdomen and uterus when a vaginal delivery is not considered safe or feasible. It may be performed electively for medical or non-medical reasons or as an emergency intervention during labour or childbirth complications. The decision to perform a C-section should be based on careful assessment of your individual circumstances, medical indications, and the risks and benefits associated with the procedure, with the goal of ensuring the safest possible outcome for both you and your baby.